Hello, I am Dr. Aniku. Welcome to Women's Health and Fertility, your trusted care for every stage of a woman's life. Today we are going to talk about a condition that affects millions of women worldwide, PMOS, previously known as PCOS. Many women struggle with irregular periods, weight gain, acne, difficulty getting pregnant, or excessive hair growth without understanding the real cause. PMOS is one of the most common hormonal disorders affecting women of reproductive age. And the good news is that it can be managed effectively. In this video, we shall discuss what PMOS is, how it is diagnosed, the investigations required, and available treatment options. So stay with me until the end. PMOS stands for Polyendocrine Metabolic Ovarian Syndrome. Previously, it was called PCOS, Polycystic Ovary Syndrome. The new name better explains the condition because PMOS is not just a problem of the ovaries. It is a hormonal and metabolic disorder that affects the entire body. Women with PMOS may experience irregular menstrual periods, difficulty ovulating, excess male hormones called androgens. Other symptoms include weight gain, acne, excess facial body hair, hair thinning, and insulin resistance. Some women may also experience anxiety, depression, low self-esteem, and fatigue. Doctors use international diagnostic guidelines to diagnose PMOS. A woman is usually diagnosed if she has at least two of these three features. Number 1, irregular ovulation or menstrual periods. This may include missed periods, infrequent periods, very heavy bleeding, difficulty predicting menstrual cycles. Number 2, signs of high male hormones. This can be excess facial hair, acne, hair loss, or elevated testosterone levels in blood tests. Number 3, polycystic ovaries on ultrasound. The ovaries may appear enlarged with many small follicles. Doctors must also rule out other medical conditions that can mimic PMOS, such as thyroid disease or other hormonal disorders. Several tests may be done to confirm the diagnosis and assess overall health. Blood tests may include testosterone levels, LH and FSH hormones, prolactin, and thyroid function tests. We also check blood sugar, insulin, and cholesterol levels to assess metabolic health. A pelvic ultrasound checks the appearance of the ovaries and the thickness of the lining of the womb. Because PMOS is linked to metabolic disease, doctors also assess blood pressure, weight, BMI, and heart disease risk factors. Treatment depends on the woman's symptoms, age, and whether she wants pregnancy. Lifestyle modification is the foundation of treatment. Women are encouraged to exercise regularly and eat a balanced diet. Reducing processed sugars, maintaining healthy weight, sleeping adequately, and managing stress are critical. Even modest weight loss can improve hormones and fertility. For menstrual regulation, doctors may prescribe combined oral contraceptive pills or progesterone therapy. These help regulate periods and reduce androgen symptoms. Metformin is commonly used to improve insulin sensitivity and help regulate cycles. For women trying to conceive, ovulation-inducing medications may be used, such as letrozole, clomiphene citrate. Some women may require assisted reproductive techniques if pregnancy does not occur naturally. Treatment for excess hair and acne may include hormonal medication, dermatologic treatment, laser hair removal, or skincare therapy. Early diagnosis and treatment of PMOS can prevent complications such as infertility, diabetes, high blood pressure, heart disease, endometrial problems. Remember, PMOS is manageable, and many women with this condition go on to live healthy lives and have successful pregnancies. Thank you for listening. This is Aniku. If you found this video helpful, please like, share, and subscribe to Women's Health and Fertility for more educational content on women's reproductive health and fertility care. See you in the next video.